Local Women Magazine presents Local Women Podcast, the show for things that matter.
Hi and welcome to our health podcast. Today I'm delighted to have with me Chantale from ACCA Longevity Clinic, and today we're going to explore all about longevity medicine. So welcome.
Thank you.
So could you actually tell us what longevity medicine actually is?
So the easiest to describe it is longevity is trying to help you age well. Our goal is trying to get you to 80 or 90 and be pain-free, be mobile, and be able to enjoy your retirement. It's not about getting you to 200. It's just about aging well and with as little complications as possible.
Lovely. So the service, I had the pleasure of actually visiting your clinic, and it was so interesting. I wanted every treatment. So could you sort of tell me what your go-to treatments are at the moment?
If it's for longevity or something acute or chronic, my go-to personally is hyperbaric oxygen therapy and NAD or NAD. Whereas the rest, whilst insane, I absolutely adore them, are very much the cherry on the top. My fundamentals are hyperbaric and NAD because when you look at chronic disease of aging, there's sort of three pillars that sort of develop diseases, and it's hypoxia, chronic inflammation, and lack of NAD. And both hyperbaric and our NAD infusions sort of alleviate those. So if I can get the inflammation down and oxidative stress to a low level and help replace your NAD, it just helps your body function better and help relieve any of the issues that may cause diseases down the line. Whilst likes of infrared saunas, compression therapy, cryo, they just add that extra little bit of whether it be soothing or energy to a treatment, but 100% hyperbaric and NAD you can't go wrong with.
So we're just going to pull back ever so slightly there. So we talk about hyperbaric chambers. Now you and I both know, I know more since I actually visited. Could you explain to our listeners what is the hyperbaric chamber?
So hyperbaric or HBOT is a sealed chamber. So there are different chambers around. So if you did a bit of a Google search, you can see like a 1.3 soft shell, and it's like a tent, to a multi-chamber, and I call it the party bus. And it's a 2.0 chamber. Now, not everybody needs those big higher pressure chambers for the likes of diving accidents or vascular issues. So don't think you need those big chambers. But the idea is we put you under a mild form of pressure to dissolve oxygen into your liquid plasma, and that is the non-red blood cells in your blood. So by allowing more oxygen into yourself, we can help create new blood vessels, reduce inflammation, and help promote healing, allowing the body to function better. So in terms of overall benefits, if you have an injury, any wound, whether it be surgical or something on a pitch, you can really help sort of increase the recovery time. If you're looking at something more severe, so just say a stroke, we've had really good results with stroke recovery. My brother, who's got a cognitive disability, we've noticed that his aggression and his agitation has been really settled since using hyperbaric therapy. I use it to prevent it and to help with my athletic recovery. So you basically just lie down, just relax, take nice deep breaths, and it doesn't feel like you're in a pressure tank. There's more pressure in a plane than there is in our chamber. It's a 1.5 chamber. It's nothing too aggressive, but it's enough pressure to get you the results.
And how long is the session?
30 minutes or an hour. I do recommend the hour because you're under the pressure for longer. However, I do know not everybody has an hour, and some people just can't sit there for an hour, and that's 100%. So if you're a newbie, I do recommend 30 minutes so that you get to know us, get to know the therapy, what it feels like, and then we can progress onto an hour. But 30 minutes is better than zero in my book.
And how often? Is it weekly, monthly?
Depends on what you're wanting. So if you had an injury, you've had surgery, you could do with the 40-hour protocol. And that is a clinical study that's discovered that 40 hours under pressure does help with certain sort of ailments and injuries. So if, say, you've had surgery, I would say at least 20 sessions, 2 to 3 sessions a week, because I need to get this oxygen into your body, create new blood vessels, and get you healing. If you are just looking for longevity, 1 to 2 a month. more is not always more in these cases, but we will guide you in ACCA to sort of help you get the best plan for yourself.
So we also talked about NAD and NAD Plus. I know it's like your little baby.
It is.
It's everywhere at the moment. All over social media, on the magazines.
I was talking to the Uber driver about it.
And it's even at the conferences that we're at the moment. And I know I shared my experiences with you about the different lectures I've sat in on NAD. But could you explain to the listeners what NAD actually is? Because it did take me a wee while to get my head around it.
So did it with me. When I first started, I was like, what on earth is this? First of all, how do you say it?
Yes. Is it NAD? Is it what's NAD?
NAD Plus.
And then you've got the NMN.
And NR.
Yeah. And it was so complicated. Yeah. So like to me, the NAD or the NAD Plus is the gold standard.
Yeah.
So, and the NMA is,
NMN.
Is a derivative of it, isn't that?
So yeah, it's NR, NMN, NAD, and then NAD Plus.
Yeah.
So we give you NAD Plus because it's ready to go, ready for your body to use. So you're cutting out the middlemen. There's quite a few middlemen in there. And when we inject it, whether it be IV or injection, you're getting the full whack and it's ready for usage. So you're not losing a byproduct. So if I give you NMN, by the time it converts to NAD Plus, you've lost quite a bit of it.
And again, so can we sort of...
What it is?
What it is it?
So NAD or NAD, it stands for nicotinamide adenine dinucleotide.
Well done.
It's taken me a long time to learn to say it. Little chunks, actually. It is a coenzyme in your body. We all have it. And sadly, as we age, we do deplete. We also lose the ability to recycle it. So by the time you're 40, you've lost 60%. By the time you're 60, you've lost 80%. And the easiest way I sort of explain that in our clinic, and hopefully it made sense when I explained it to you in the clinic, is we are just billions and billions of cells. And all our cells have a little engine called the mitochondria, and we need fuel for those. But for us to make our fuel, you need NAD. So when we say NAD helps with energy, is because you physically need NAD to make ATP, which is the fuel for your cells to function. And it's your heart cells, your brain cells, your skin cells, your immune cells, they all need fuel to function. So imagine if you're not able to create that fuel, all your other cells will suffer in the long term. So it's fantastic for energy. It's fantastic for and essential for amino acid and fatty acid conversion. So for us, if you had a wound, you need energy to have your body actually say, right, okay, I need to heal this. But then you'll need fatty acids and amino acids to physically knit your skin. If it's tendons, joints, you need those amino acids, but you need NAD to make that. So enhanced recovery. It's also essential for DNA protection and repair. And when I mentioned a bit earlier about the 3 pillars of chronic diseases, the reason NAD is so important is it has this little system where it goes looking for broken cells, which can, if left to their own devices, become something quite sinister in the future. So our body has a system to go shopping for these broken cells and gets rid of them. And if it gets rid, just say of 100 heart cells, your body will replace those heart cells. Don't panic thinking, I'm going to run out of cells. That's what your stem cells are there for. So we need to have our body as sharp as a tack to go looking for broken cells to replace them and ensure that your body is able to work at 100%. It's fantastic for cognitive function, fantastic for sleep. I've had really good results with my clients with long COVID. I had a lot of clients with chronic fatigue, brain fog, and even my sort of busy business owners who just say, you know, I have 101 things on my plate, I'm stressed, but I can't sleep. They're just able to get their NAD, and then all of a sudden they're just more productive. And they just can't explain it, they just feel more productive.
And so the NAD in your clinic is either IM injection form or IV through a drip.
Yeah.
Is that correct? And you have like NAD or NAD plus, and that's NAD plus at home as well. Isn't that correct?
So the injections you get in our home kit is exact same as what I give you in our clinic. Same vial. So the only difference is obviously the dose. Now per 100 milligram or 250 milligram, the home kit is cheaper. Now, you don't get me with it, sadly. That's why it's cheaper. But for someone, just say, who lives sort of your direction or lives in England, they obviously can't come to our clinic all the time.
Yeah.
So it's a really good way of doing little and often I also have people who just don't like IVs. Mm-hmm. They don't mind the injections, but they just don't like the IV. They don't have the time for an IV. So they would rather do 3 injections, 2 injections a week and get their NAD rather than a IV, which does take roughly an hour. Now, the beauty of the IV is you get a larger amount, and we give you glutathione as well, which is included in the price. So you're actually getting 2 IVs for the price of 1.
And just to explain, I know that glutathione is the guardian of the cell, but could you explain just to the listeners what glutathione actually does?
I kind of give the analogy of if you had a foundation and it was broken and you built a house on top of it, it's going to be a weak house because the foundation's broken. That's the same as a cell. If you have a damaged cell and NAD comes in to try and help it work better, it's not going to do its job that it wants to because the cell's broken. Glutathione comes in, flushes off the oxidative stress, which damages the cell, allowing that cell to be nice and healthy and functioning optimally. So when the NAD comes in, it's able to maximize the results.
Yeah.
It's fantastic for detoxification. We had really good results with menopause as well.
Yeah.
Very good for those with any gut issues. We just found that our results are better with our glutathione. So we made a decision that we're just going to give everybody glutathione with their NAD.
So just moving on from, I mean, they're 2 amazing treatments and they're like your go-to. I mean, you had a vast amount of treatments when I was there, like the cryotherapy.
Yeah.
Could you explain to the listeners what cryotherapy you offer and the benefits what it would be for one of our listeners?
So cryotherapy basically translates as cold therapy. So technically ice baths are cryotherapy, sea swimming's cryotherapy, but we use nitrogen. And the reason for that is, yes, it's colder, but it's actually more comfortable. So we put you in a chamber where your head's out. You do wear our lovely ACCA Uggs and our ACCA mittens. And we put nitrogen vapor inside the chamber. And we are with you the entire time. And we trick your body that's in a very cold environment by blowing cold air on your skin. So it vasoconstricts all your vessels, allowing the blood to be sort of circulating around the essential organs in your brain. It's fantastic for reducing inflammation. Because you're so cold, your body's going to try and trick you to pretend it's not in that cold environment by sending a ton of endorphins, so you have a great energy buzz. It uplifts your mood. Fantastic for jet lag, I can attest. And you can use it actually for both physical and mental health. Physical, just say you're an athlete and you're quite sore from training. It's a really good way at getting that inflammation down, allowing you to maybe go and train the next day. I do know some professional athletes do it pre-event because you do peak in terms of energy 2 hours post.
Right.
So they would do it 2 hours prior to their fight or their match and then go and play their sport. And in terms of mental health, I had a few clients with a lot of anxiety and really poor sleep, and they found that during that session, they're too busy concentrating on the cold that they don't focus on what they're worried about. And they come out and they're like, what was I worried about again? I'm like, don't know, not sure.
And there is some patients that aren't suitable though. I mean, like if you've got hypertension, you're not a good candidate.
So even if you
or high blood pressure, sorry.
Yeah. If you don't have it, we check everybody's blood pressure. I've had a few people who definitely don't have a history of high blood pressure, but they had one too many coffees.
Right.
And unfortunately, I couldn't allow them in. Raynaud's is another one.
Yeah.
Vascular issues and certain diabetics. Everybody's different, so I do take it as a individual basis. And even some people who don't have those, I kind of look at their skin quality. I'm like, do you know what? I don't think the cryo is suitable for you.
Yeah.
So what I might do is I might try local cryo, so it's not in the chamber, but very localized to that one area. And I'll say, look, I'll try on, just say, your wrist. If your skin is okay, we will try the chamber, but we won't go as cold, just so I can assess their skin.
Yeah, it's a good safety measure. Yeah. Infrared sauna. Now, I loved that now when I was there.
I love the sauna.
So could you explain to everybody what is the benefits of infrared sauna?
It's just amazing.
Isn't it?
I'm actually using it quite a lot for my next shows, to be honest. So a difference between the infrared sauna and a traditional is a traditional heats you from the outside in. So it's very hot, very moist or humid. I personally can't stay in them. They're too hot.
I can't stay in them very long either.
I think I've lasted 5 minutes was my max. Whereas an infrared sauna heats you from the inside out. So our hottest we go 66 degrees, which is very cold in comparison to a traditional sauna. And by heating you from the inside out, we not only really help heat up those joints, the muscles. So if you have any injuries, we recommend do your physio in there. But it's fantastic for detoxifying. It's actually used for heavy metal poisoning as well. It is fantastic for cardiovascular conditioning. So if you have somebody who has high blood pressure, isn't the healthiest, but they're like, I want to try and get fitter, we say, get in the sauna because your heart rate is elevated. Mine's usually 140 in there.
All right. Okay.
So you're doing cardio, but you're not moving. It's really good for de-stressing and just relaxing. I think people are so busy, work, just general life. It's nice to go in for 25 minutes and just turn off. And the beauty of our sauna is when you go in, it's yourself. Now, you can bring a partner. I don't provide the partner, but you can just go in, music on, lights off, and just relax. So it's really good from both a mental health and a physical health.
And how many sessions or how often would you recommend the infrared sauna?
To be honest, 1 or 2 a week. Now, there has been a study in, I believe it was a Scandinavian study that showed if you do a sauna 4 times a week, you reduce your risk of cardiac death by 75%. Now, I don't have any clients who come in 4 times a week, but just what suits your needs as well. Now, we have a few individuals who are going through a protocol, just say recovery, they would do it after the hyperbaric, but it's not necessary.
Okay. And also I noticed you had pressure therapy. So you had the lymphocytism and you had another pressure therapy treatment. Yeah. Do you want to explain what pressure therapy is? We offer that as well in our clinic and we're getting fantastic feedback from it. Even just from people sleeping better. Yeah. Really good for heavy legs, circulation, bloating, menopausal bloating. Yeah. We're getting fabulous results. What way would you be using it in your facilities?
So we, as you said, we have 2 types. We have the lymphotism from ATL and then we have the Air Relax Pro, which is more so a athlete recovery. So if you probably see like a figure skater or a hockey player, they would use those quite a lot. It's a higher pressure. So our lymphotism, it's not that high of a pressure, but there's more chambers.
Yes.
Whereas our Air Relax is only 6 chambers and it's double the pressure. So if you are a runner, they love the Air Relax because it's a really deep massage and we're just putting a lot of pressure, like a blood pressure cuff, but on your leg. And we're forcing all the excess waste and the extra blood out of your limbs. And when it deflates, all that blood is now fresh, full of oxygen, and it goes back into your limbs. So you feel like your legs are really light and refreshed, like you never trained. Whereas lymphotism has a lot more settings, whereas our Air Relax only has 4, and they're just heavy. So whether it's cellulite detoxification, lymphatic drainage, we very much have a consultation with our clients to see what their needs are. And unlike the athlete compression, more is not more.
No.
They will pop open. So we have had really good results, and it comes to a stage where some people just want to relax.
Yeah.
So I just put them on the lymphotism and choose a low setting, not that high pressure, but enough that they feel it. And half the time they've come in, they're fast asleep.
Yeah, I had a patient on Thursday night, fast asleep on it.
I feel bad. Same with the hyperbaric. At least you can wake them up on lymphotism. The hyperbaric is a bit more difficult. I tried phoning a patient once and they were completely zonked.
Isn't that a testament, though, to the treatment? So you had so many other things. That you've got the Emcella chair for obviously for incontinence and also for sexual function. And then you had the M-Sculpt, am I correct? M-Sculpt Neo, and you can do the core to floor. So how does that fit in with your longevity sort of protocols, if you don't mind me asking?
Yes, a lot of people think we're very health-minded, but a lot of things affect people mentally, emotionally, and physically, as well as physically. And we're trying to think of outside the box, not just conditions and diseases. And incontinence is a big thing, and I think it's very well hidden. Mm-hmm. And I've had a few women this week actually saying, oh my God, I just want to spend a bit of money on me. And I'm just so embarrassed. I'm like, it's okay.
Yeah.
You can come in here. It's your safe zone. Nobody needs to know. And we've had really good results. with our incontinence.
Yeah.
I haven't had many with sexual dysfunction.
Yeah.
I think because it's not very well known.
It is a difficult one. It's a difficult message to get out there. I have a background in gynae, and we do a lot of the Emsella chair in our clinic as well. We've got some fantastic results for stress and urge incontinence and combined. But as well, we're doing quite a lot of work with male clients post prostate cancer.
Yes.
That is a phenomenal,
And
life
TERPs as
changing.
well. And TERPs as well. And I think people realize that if they have one issue less, especially like incontinence, they just feel so free.
Yeah.
And emotionally, they're so much happier. And it's like a domino effect. And it's a very simple treatment. You sit.
I think because
fully
they keep the
clothed.
clothes on. Yeah.
And now, obviously, with our first session, because it's finding that right position and trying to explain it sometimes is a bit awkward. But once they find it, it's like a light bulb and like, oh, okay.
Once you know when you're sitting on the chair, right?
And I'm like, okay, I'm going to give you 5-10 minutes. And I usually put some music on, or if they have their phone, we'll say like put a podcast on YouTube and I'll come back. But as the sessions come on, I kind of leave them for longer spells because they're in the swing. They know exactly what to do.
Yeah.
But it's quite sort of really nice just to see that light bulb moment, like, oh my God, I'm finally getting it sorted. And they get really good results really quick.
Yes,
as
don't
well.
we? And then we put our patients on a maintenance program then. Yeah, I would agree. And it's very rewarding.
Yeah.
It's a very rewarding treatment. So I had a look into your sort of treatment protocols as well. And you had a really good one for sleep management.
Yeah.
And I know sleep is a major issue for a lot of certain age ladies, and probably people that have got stress levels and things like that. So could you talk me through your sleep program? Because actually I was extremely interested in it myself.
People don't realize when you have a really poor sleep, it has such a detrimental effect on both your physical, mental and emotional well-being. People don't realize that when you sleep, that is when your body's recovering. That is when your body's, your liver's functioning. That is when you're healing. So if you have a poor quality sleep, its job that night is going to be a poor result. So first of all, we always find out like what is the root cause. So is it you're having a coffee before bed? Well, that's not going to help. So I do ask a few questions like, what is your sleep routine? Are you stressed at work? What is your typical evening? Sometimes they're just doing so much, their body's just hyped up. And so once we find out anything that's outlying, we can try and fix the lifestyle factors. And then I'm like, okay, now we need to bring the body down. So the hyperbaric, we're forcing the body into the parasympathetic mode system. So the rest and digest, as opposed to the fight and flight. And that is when your body sort of ends up whilst you're sleeping. So the hyperbaric helps you getting sort of settled. Now we would put the head cap on and the eye mask. That forces you to relax.
Yeah.
And then we put you on our light bed on the relaxation mode. So there's a mixture of blue light and infrared. I think there's a little bit of red as well. And people come off and they're like, oh my God, I just literally feel like I've been on holiday. Sometimes people are fast asleep on that bed and I'm having to wake them up. Sauna's actually a really good one as well because, again, you're being left alone and you can just focus on your thoughts and just breathe and just relax. I actually found NAD is a very good one as well for sleep. Both the light bed and the NAD helps with your circadian rhythm, which is your natural sleep sort of pattern.
Yeah.
And with the NAD, sometimes it can keep you awake first just because your body is trying to get into the correct circadian rhythm. But because NAD helps with stress and it has that antidepressant effect, people find that they're not as stressed, so their body's able to relax better. So it's finding the right protocol. I had a lady who came in literally shaking. And I was like, what happened? I actually thought she got attacked on the street. She was so visibly shaken. And she's like, I've had a horrendous day in work. I'm just so stressed. I haven't slept all week. And I'm like, okay, the clinic's empty. I know exactly what I was going to do with her. So I put her on the hyperbaric and I put her with the head cap and the eye mask on stress mode. Then she did 10 minutes on the relaxation bit. And then she did a NAD. Instead of the IV, we did a 250 milligram injection. And 8 o'clock the next morning, I got an email saying, I don't know what you've done to me, but I have never slept so well in my life. And I'm like, you were overstimulated. I just brought you back down where the body was able to relax. And she was like, oh, okay. And so now every time she comes in and she's like, I need to do
But you did
what you did
before.
And I'm like, okay.
I think I might need to do that as well.
It is so good.
So if anybody that's listening that is really interested in the services you offer, they just get in contact with ACCA?
Yep. So you can either phone us or you can pop in or you can email. However, I do always like to have clients come in so they can see the machine, get to know us as a team as well. I'm the kind of person that if I don't think the therapies are correct for you, I will turn the business away.
Yes.
Because I don't want you spending money on something that I don't think you're going to get the results with. Now, if you just want to jump into the sauna for the sake of it, that's fine. Because a lot of our therapies, just say for like an injury, you do need to invest in that protocol. And if you're not going to get the results. And I'm very straightforward with that. And I'll say, look, this is the protocol. So
well, I think a lot of us appreciate that, you know. So what's new for ACCA? Is there anything coming else in the future or what's the plans?
Our ACCA home kits are sort of the latest thing to come through. And then hopefully in the next year or so, we are hoping to expand. So I am looking for new nurses as well. It's trying to find the right team as well, because we are very much all about, you know, clients first and educating. I'm very much the educator in the clinic. I want you to understand if you are getting hyperbaric or sauna or cryo, you know exactly what you're getting yourself into. You understand how it's working internally, because you don't get instant results for the majority of our therapies. It is, you're in for the long haul. And then hopefully as we expand, we will get another hyperbaric machine, maybe a dual chamber, so you can have a couple in, or somebody with maybe who's struggling with mobility, instead of climbing into the hyperbaric, they can just walk in.
Yeah.
That is our goal. So bigger premises. And I'm not sure about other therapies just yet. It's all about, you know, seeing what's effective, you know, what's the research behind it, and what's it going to do with longevity.
Mm-hmm. I think it's really important just to sort of highlight that longevity medicine is fabulous. There's so much research behind it, but it doesn't replace conventional medicine as well. It complements.
I'm very much, as soon as someone comes in, I'm like, I am not replacing your doctor. I'm not replacing your surgeon, your physio. I'm very much working alongside it. Because I have a few cancer patients emailing me recently saying, oh, I want to do this instead of chemo. I'm like, it doesn't work that way. Now, I will need to screen you. And the first thing that pops up on your screening says, do not turn away conventional medicine or hyperbaric. I want to work alongside your doctors, your specialists, because together we can get your results quicker maybe, or more effective. And I think I've had a few physios who are worried I'm trying to take their work away. I'm like, no. I actually want your work to improve, because we're reducing the pain and the inflammation, so you can really get in there and help that mobility. So we're definitely not replacing hospitals and medicine. We're just helping them achieve their goals.
Thank you.
You're very welcome.
We could talk forever on
We
longevity.
really could.
I mean, it's so interesting, and you've so many more therapies as well.
Yeah.
But if you're really interested in longevity medicine, give ACCA a call and maybe message you and ask you some
100%,
questions.
yeah.
I know I do some of the same services as yourself. So if there is any questions from the podcast, I'm happy to answer them as well. So thank you so much.
Thank you so much.
Local Women Magazine presents Local Women Podcast, the show for things that matter.